Okay, are we ready? Are we ready? Are we ready? So, it's the end of our second annual Guyana Wellbeing Conference, and I dare say it has been a success. Is that correct? And it's been a success for the same reason that we just told all the kids who were here. It was a success because of your voices. Your voices were much louder and clearer this year than last year. And I expect that they will be even better next year. The other voices that came to the table this year, many people came to the table who had not been here before. That included a number of ministers, a number of agencies. They came to the table and they have agreed going forward that they are going to be part of the solution. I think that is a great, great success of this conference and of every one of you who played a role in talking. You used your voice, you brought people to the table, and you had people share at this conference in a way that many people have never had the opportunity to share before. So, when we started the conference on Tuesday, we talked about 3 things that we set for ourselves, targets last year. And we talked about the 2 that we succeeded at, and the 3rd one that we didn't quite make the mark. Before we leave here today, I want to do the same thing. I want to hear and help us decide on 3 things that we can do between now and this time next year, because like I somewhat maybe foolishly said last year, we should do this every year. Well, we're going to do it again next year. So, so let's figure out 3 reasonable things that we can do. We actually have 3.5 things that we're going to do, the one that we didn't finish and the 3 new ones. So before we leave here today, we're going to identify what those are. But before we do a lot of things, I would like to ask Minister Anthony to come up and to talk about, from his perspective, what has happened as a result of this conference. Some of the things that he referred to on Tuesday, like the fantastic new bill, the law for mental health, where we are with suicide, and what he sees going forward that people attending this conference can do and contribute to the cause. The cause is one, again, of getting us off that list, that top 10 list. That's our goal. We're going to move off of that list. So, Minister Anthony, could you come and address the wonderful audience?
Good afternoon, everybody. First of all, allow me to thank Professor Hoven and the team from Columbia University and everyone who's been involved in the organizing of this conference. I think you would all agree with me that we've had a very productive and successful conference. And for that, everybody deserves a big round of applause. After the first conference, we had started talking about getting legislation implemented, getting a few things done. And I think over the last year, we were able to achieve some of those things. But we have 2 pieces of legislation now. That's the Health Promotion Act, and we also have the Suicide Prevention Act. with the Health Promotion Act, there are a number of things that we need to do as we started the implementation of this act. One of which is to reorganize our entire healthcare system to cater for mental health patients. And in that reorganization, instead of having maybe standalone institutions, we have to integrate mental health into our primary healthcare setting. So to do that, over the next year, you'll see us do more training, especially for nurses and doctors who are working in a primary healthcare setting. And when we come here next year, I'm sure we'll be able to report on how we would have done this integration. We also would have to look at establishing a number of boards that were contemplated under the two pieces of legislation. One has already been appointed, and under the Suicide Prevention Act, we have to set up a Suicide Prevention Commission, which is a multi-stakeholder body. So by the next year, we would have that commission established, and they would have already started doing work that has been contemplated by the legislation. So there are a number of things right now that we'll have to put in place. And by next year, I'm sure that the team from the Ministry of Health would be able to report on some of these things. Another key area that we'll have to work on is really deinstitutionalization. Again, in the legislation, it contemplates that the patients that we have in some of our psychiatric facilities, that many of them with adequate treatment should not be in these institutions, but should be at home with their family and to be able to access treatment when it's necessary. The big challenge that we have is for existing patients. We have about 200 or so patients at the National Psychiatric Hospital. More than half of them can actually go home. But the sad truth is that the families, the persons who they would normally stay with, they don't want them to come home. And that's part of the problem. So while we are willing to discharge these patients, at this point in time, many of them, they have no home to go to. And that's something that we would have to search for another solution. If they can't go home, then what are the alternatives? And if the alternative would mean that we will have to perhaps build halfway homes and so forth, these are things that we'll have to explore. So this is another area that we'll have to focus on as we move this whole process of reforming mental health in our country. While there have been a lot of discussions during the last couple of days, I think maybe in some of the discussions, what might have come out would have been that we have in our midst a substance abuse problem as well. And drug abuse is a serious thing. There are legal substances that are available to people, simple things like cigarettes, alcohol, that you can legally acquire. But alcohol can lead to other problems. So we might persons started out drinking a little bit, and then they end up with psychological and physical addiction or dependency. And that has been a problem in our community. But now we also have other drugs that have permeated our community, and we need to take action in terms of how we would prevent the abuse of these substances, and persons who have been abusing these substances, for us to help them to wean them off of these addictions. But when we look at the amount of rehabilitation facilities that we have and who are actually doing rehabilitation, we would find that there are perhaps just two institutions that have been doing that: the Salvation Army and Phoenix Recovery, both of whom have been receiving subventions from the government. But the amount of persons that they have to work with, I think, has become overwhelming now. And so we have to look at how do we develop other partnerships and make sure that we can tackle this problem in a more holistic way. And so this is one of the areas that we have focused on in the ministry as well. And so as we work to develop mental health facilities and services, certainly in the area of rehabilitation would be one of those areas that we'll have to put more focus on. Neurodevelopmental disorders in children is another area that we certainly have to focus on. As we get better at making diagnosis, we have seen that the number of cases of autism and those on the autistic spectrum, we have been able to do more diagnosis in this area. And as we make these diagnoses, we have to develop multidisciplinary teams to be able to work with these children. And again, there might have been some attempts in the private sector or in the NGO sector, but these are services that we need to offer in the public sector in a more holistic way. So I guess over the next 12 months, this is another area that we'll pay some attention to and hopefully develop more holistic service. So on our side, there are lots of things that we have to do, but arising from the conference itself, the discussions that we have had here, one of the things that we should do is to pull the recommendations from various presentations and see how we can incorporate this into the work that we do. We don't want this to be an academic or a theoretical exercise. It is good that we can have the discussions. It is good that we have created a space for the discussions. But what we need more than ever is to take the recommendations that come from the conference and see how we can incorporate it into policy and into an implementation plan, so that next year when we come here for the next conference, we can actually show and point to things that were discussed and where we have been able to accomplish and start working in particular areas. I think if we are able to do that, then this conference certainly would become more meaningful. We also see that this conference, from its first and now the second edition of this conference, that we have been growing in scope. And we are very pleased that so many global experts have come to share their views with us, have come to share their experiences with us. And because of those discussions, I think we are all enriched and we have more knowledge pertaining to some of these areas in mental health. Many of the things that we are working on right now, other countries might have gone through similar challenges. And rather than reinventing the wheel, what we've been able to do is learn from those experiences and see how we can customize and adapt some of them to suit our setting. And I think that's of real value to all of us, because we now would have been able to apply or take some of these things and apply them in our setting. The University of Guyana and the Deputy Vice Chancellor, Dr. Cummings, is here. They have also played a very integral role as we start rolling this conference out. And we expect that they'll continue to play that role. There are courses, there are things that, learning experiences that we have been talking about. And during this particular conference, we have been able to experience some of it. So for example, in the area of resilience training, that is an area that certainly can help people to cope with stress and so forth. And this is something that we certainly want to roll out. But very often, when we talk to people and people come for training, they very often would like to have academic institutions, the names of academic institutions attached to whatever certification we are giving them. And so far, there are a number of courses that we've been able to work with the University of Guyana on, and they have, having reviewed the curriculum of these courses, they've been able to accredit them. So I hope that the resilience course that will be done, not just during this conference, but later in the year, because through IDRF, one of the partners that have been here, we expect that we'll be training literally hundreds of people in resilience methodologies. We have already spoken to them about how we can do this. And one of their partners would be the President Youth Advisory Council. And another partner would be the Men on Mission, so that we can help various groups to build resilience. And hopefully, as that permeates the community, we'll start seeing a change in many of our communities. So there are a number of takeaways here. And as I've said at the very first conference, I think the recommendations, we need to take them. But a lot of the presentations that we have seen over the last couple of days, that we also need to publish these presentations, so persons who have not been able to come and attend, that they would be able to at least go through, review, and maybe learn from these presentations. We, of course, are very thrilled that we have been able to be part of this. The Ministry of Health, its various departments who have worked with the team here in helping with the organizing and in helping with rolling out this particular program. We look forward that in 2023, that this conference would certainly grow. We expect that apart from local participation, and we want that local participation to be even bigger, that we would also be getting a number of persons from the regions, region meaning from CARICOM, who would be coming in here to participate in this training. Already a very good sign has been that we've had both UNICEF and PAHO taking part in this particular conference. We expect their participation to continue in future conferences, but we can only see this grow from this phase to even a bigger conference where people would start putting it on their calendar. We intend, as we develop the health sector here, that in many of the areas that we are working on, whether it's in mental health, whether it's in oncology or cardiovascular surgery or whatever it is, that eventually, and with the inputs that we are making, that Guyana would certainly become a hub, not just for health conferences, but also a hub for training. And this is something that we are actively working on. We have seen that early in the year that President Biden made an announcement at the Summit of the Americas, where the US government would like to offer 500,000 training opportunities in the region of the Americas. And PAHO has been mandated to come up with how that is going to work. And we have offered to PAHO that we want to see Guyana as one of those hubs where we can develop some of the training programs and help to run them for the rest of the region. And just last week, myself and the director of PAHO, Dr. Etienne, along with Dr. Tedros, the Director General of the WHO, we had a meeting, and we have decided, and WHO has put some funds to catalyze this process. So the WHO would be giving to PAHO $2 million to catalyze this process in moving the discussions forward in how we can roll out training in the region. So we have been doing a lot of work, and we see what we have done here in mental health. And what we'll continue to do would certainly improve the quality of care that we can offer to patients. And over the years, we want to make Guyana into a model where other places can come here to see how we are doing and how the quality of care that we are able to offer to mental health patients. Mental health issues are not going to go away. And if you look at the projections, the statistics coming out from the WHO, one of the things that they are predicting is that as the world gets more complicated and more busy, and lives of people become even busier and become even more stressful, that there would be a need for a lot more mental health services. And they predict that mental health would be among the top 5 diseases that would cause all types of morbidity. So this is something that we have to take into consideration. And as we plan for this, we have to work very hard to make sure we have the systems in place so that Guyana does not become one of those countries. At the end, one of the simple tasks that we have been working on is to get Guyana removed from the list of the top 10 countries that has the highest rates of suicide. And I believe that we can do it. If you look at our absolute numbers, last year we had 165 persons who completed suicide, and that's a lot of people. This year, we have seen a drop, but we are not there as yet. So far, we have had 100 persons who've committed suicide, and that's still a lot of people. But we intend, if we work very hard, that we can actually bring this down in a very significant way. And with all of the inputs that we've had here today, and with all the programmings, the different things that we'll be doing, the different interventions, the studies that Columbia University is doing right now, learning more about the factors that can cause this, some of the things that we right now perhaps do not understand. All of this, as we get the information, we'll use it to further reduce suicide in Guyana. When we tell you that we want to come off this list of the top 10, we're really serious about this. And if we recalibrate the numbers from what we've been seeing from 2019, I don't think that Guyana would be in the second spot. But we still have to work on reducing these numbers. 100 people dying by suicide is still a lot of people. And then when you couple that with the persons who are dying in accidents, that too is a lot of lives being lost. The prosperity that this country is going to experience over the next couple of years, we want people to live to experience this prosperity. We want people to be part of this transformation that we are undergoing. and we want people to have enriched lives. Sometimes people are vulnerable for a moment, and if we help them through that moment, through that rough patch, they can get through that, and then they can blossom and do many good things. That's what we want. So there are times in each one of our lives when things might be a little bit tough. But if we have the network, if we have the support, if we have the facilities to help us through that patch, we are all going to be blossoming and be able to live enriched lives that would contribute to the development of this country. That's what we want. And so if we work together, work as a team, it's not the Ministry of Health alone, it's a team effort, a societal effort that would get us off this list of being in the top 10. We want to be in the bottom hundreds or something. We don't want to be in the top 10 for this one. So next year, let's see where we're going to be on the list. And if we can drop that significantly, then I think one of the tasks that we have set ourselves in this conference would have been achieved. But I just want to say a big thank you to everyone who participated, especially those who made the presentations. Thank you very much.
Thank you very much, Minister Anthony. That's it's a hard act to follow. What he has essentially done for us is to summarize where we are and where we need to go, and where I think this conference has generated a lot of knowledge and commitments to that end. I don't want us to go away from here again thinking, we got a couple of things that we need to do. I think Minister Anthony outlined a very large agenda. It's an agenda that requires, as he said, and I've said repeatedly, everyone has to come to the table. And one of the objectives of this conference is not to go in one direction or another, but essentially serve as a meeting ground and an opportunity to bring everybody to the table. And I think we did that very successfully. And I think one of the outcomes had to do with where we are with the training program that's at the University of Guyana. So that training program is designed in part to be half of the students come from the university and half of them come from the hospital. It's an opportunity to bring those two powerful groups together to address trauma and injury, two of the outstanding contributors to mental ill health and suicide. So we cannot do any one thing that's going to get us off of that top 10 list. We have to do many, many things. And I think Minister Anthony just talked about a lot of the things that he, in his capacity as the Minister of Health, actually, he's really the Minister of Health and the Minister of Mental Health. He doesn't know that title yet, but he is really a very strong advocate for mental health. And I think we're very fortunate in Guyana to have such a minister. It's not so common that you have a Minister of Health who understands the relationship between health and mental health and tries to take this very comprehensive approach. And so I commend you for your commitment to mental health, your leadership in the new law. The law was there for 30 years, 60 years, whatever it was. He changed it. And I think we all owe a great deal of credit and to him. And I would give him a big round of applause for the work that he's done. It's really astounding, and it's going to make all the difference in the world in terms of getting us off of that terrible top 10 list. I would like to take the opportunity to have Professor Cummings come up and just speak for briefly about what's going on in this conference to be transformative for him personally, because we like to transform Emanuel Cummings. He likes to transform himself every year, actually. So if he could come up and tell us if this conference has had any salutary effect on the relationship that he has with the university and the larger world of health status in Guyana. So, Professor Cummings.
Thank you very much, Professor Hoven, Honorable Minister, other distinguished persons that are here. You know, the last thing the minister said was to get us off the top 10. I want us to be in another top 10. Maybe the top 10 countries that have won the battle against suicide. That's the top 10, which I think we should go. But certainly, I think this conference has assured us that injury prevention is not just a matter for the Ministry of Health. It is certainly a multi-stakeholder approach. From all the presentation that we would have seen from locally and internationally, where there have been a real interdisciplinary approach in dealing with injury prevention. We have heard from psychiatrists, from social workers, from persons in general medicine, from engineering, from the school children, from everyone. And it has assured us that it's everybody's business to deal with the issue of injury prevention. From a university perspective, it is our intention as a partner in this program to ensure that we will continue to be a relevant partner. Already, internally, we have had discussions with respect to the whole issue of injury prevention as one of the top items in our research agenda. And we will ensure that having it as one of the major items in the 7 areas which we have identified as part of our research agenda, to ensure that we have both our students and staff in all of the areas seek opportunities to do the research with respect to injury prevention. I just wanted to reiterate that at this conference, we saw engineers, the whole issue of road safety, and we have already generated interest among our engineers. There were presentations from the Faculty of Technology where they spoke about how engineering of our highways, how that can help in the reduction of road crashes. We're hoping in the next conference to see persons coming from agriculture. A lot of persons would have committed suicide, would have ingested poison substances used in agriculture. And so we're hoping to see persons coming from the Faculty of Agriculture, developing policies with respect to how we can have better control of pesticides, the use of pesticides, and also having persons not having access to pesticides, because that alone contributes significantly to suicides. And so our intention, ladies and gentlemen, is to continue work with University of Columbia, with the Ministry of Health, with the Georgetown Hospital, all the key stakeholders. And I think the list have grown. We've seen social services. Somebody mentioned the Ministry of Home Affairs, the Ministry of Agriculture, all the relevant Ministry of Tourism, because this can have an impact on our tourist industry. So that collectively we can work and we can deal with this cancer of injury prevention. And so, as Minister would have said, it's given us an opportunity to really look at all of those presentations that I've already done. Look at the relevance of all those presentations, have a summary, and see how we can use those to really have policies to address the issue of injury prevention. In closing, I was really intrigued by the presentation from the students. Many of them that have shared their experiences. It tells us that there's great opportunity for our social workers, for our psychologists. University of Guyana has recently launched an early childhood center. And so there's great opportunity for us to do early intervention, knowing, doing the kinds of research at that childhood center where we can identify what are some of the issues that might have contributed to persons wanting to commit suicide or persons who later on would have been victims of domestic violence or be perpetrators of domestic violence. And I always believe that a lot of those symptoms do occur very early in childhood. And so there are many things which I think the university can expand in its research agenda and the way in which it will help as a premier tertiary education institution in Guyana to address this whole issue of injury prevention. And we are very happy that we've been a part of it. We will continue to be a part of it. And within the year, we look forward for another conference, and we're hoping to see more presentations coming from the university and even other universities, because University of Guyana is not the only university. There are other universities that were present here, and we hope to see that kind of collaboration. And so, best wishes to all of you. Thank you for giving the university an opportunity to be part of this. And Christina Hoven, and now I'm certain Minister and the government officials will at some point give her that honorary citizenship, because I think she deserves much more than that. Thank you very, very much.
Thank you very much. So we talk about bringing everyone to the table and who are the targets. Everyone's a target, but there are certain systems that are critical because they provide the ongoing infrastructure to support all of the kinds of things that Minister Anthony talked about. That is education. So today we had a fantastic opening meeting with the students from around the country. It was wonderful, absolutely wonderful. And what we were focused on was, is there a way, and is there an interest, and is there a sense that we can get the youth involved in getting us off of the top 10 list? Because again, we cannot do it alone. What do the adults know, right? Like somebody said during that discussion, the kids know more about sex than all of the adults in the room combined. So that's probably true, but they also know more about how we're going to prevent suicide than all of the adults in the room. And that's probably even more important than what they know about sex, because they got a whole life for the sex, but if they commit suicide, it's gone. So I think it's absolutely critical that the youth, the high school students, the middle school students, take up that mantle. And we have Olato Sam here from the Ministry of Education, and he is committed to supporting mental health intervention in the schools that doesn't exist today, and for supporting the youth to develop this kind of program. Whatever the youth decide to do, you have Olato Sam. I can say that, he's not in the room, so it's safe for me to say it. But he did commit that to me before he left the room, and I really believe that he is prepared to do that. We also know that what we need to do is focus on some of the other infrastructure, which is already working very hard to support the goals of getting off the top 10, and that is social services and social psychiatry, social workers, and we have a division, a department, a dean, Paulette Henry, Professor Henry, who is committed to that effort. And she is doing, again, an outstanding job of generating the next group of social workers. However, Professor Henry has said she needs help. She needs help. And that's always the first, the first thing that you can be grateful for when any leader says, I'm doing the best I can, but I need help. Well, we're going to try to find a way. We're going to start this week. We're going to be doing training at the university with the social work faculty and with the psychology faculty. Psychology faculty is the other group that says we're doing the best we can. We need help. So I would like actually for Leann Kendall to come forward and to say a few words about the psychology program. Leann has taken on a leadership role in the training program that we have that we just heard about called GRIT. And I do hope that all of you will look in your bag and you will see that there's an announcement in there for people to apply to be the next cohort of fellows that we can support and develop. We're trying to develop a research capacity in Guyana so that you all can take on your own responsibility for researching how you get off of the top 10, how successful you were, what worked, so that you can share that information with other countries. There's a million things you can do research on, and what we want to do is develop a research capacity here that doesn't exist today. We want to strengthen what you have today. So Paulette, I'm sorry. So Leann, could you come up and just say a little bit about the psychology program that again, this following week, we are going to stay here and we are going to provide some training in the psychology program. We hope to expand that kind of work.
Good afternoon, everyone. Thank you for being here. My presentation is going to be very brief as I let you know what the psychology program is actually contributing to maintaining health and well-being. Our program is quite new. The college that the psychology program falls under was birthed on the 25th of October, 2021. We celebrated our first anniversary a few weeks ago. Our cohorts are passionate. They are committed to the cause. Our first cohort, who are now in their second year, we have 60. Our second cohort, we have 95. And as we sift through applications, we realize that the young population are quite excited and ready and passionate to get on board to alleviate mental health and, to alleviate mental illness. And I'm so happy that Professor Hoven did highlight. He said we need help. We're doing the best we can, but much more needs to be done. We are a new college. We are excited and we are passionate to get going and continue contributing to mental well-being positively. And our faculty, small faculty and students are on board with the cause. We have 2 programs at this time, a diploma in general psychology, which is a 1-year program. We have a BSc program, which is 3 years. We will be introducing our MSc in clinical psychology in September. So I'm encouraging those who have an interest, who are ready and willing to contribute to the cause, send those applications in. And I'm so grateful for the collaboration with Dr. Hoven and team to reach out to the University of Guyana and collaborate with us to make a difference. We're here, we're ready to begin the work and get going to contribute to positive mental health locally. Thank you.
So one of the outstanding appointments that was made by Minister Anthony during this last year was to formalize and recognize the need for having a national coordinator of suicide prevention. And I'm looking around where she is. She's in here somewhere. Where is Alicia? Is Alicia in here? Alicia, where are you? She's out saving lives. I don't know. Okay, so we'll wait a minute for her to come back. She was in here before. One thing that people refer to all the time are the godfathers, the godfather this and the godfather that. But we all know in our heart that the most important is the grandmother, right? Grandfather this and grandfather that, but it's the grandmother, right? But we have to recognize that, and sometimes we have to acknowledge that the grandfather is also important. And in this case, Dr. William Adu-Krow is in many ways the grandfather of a lot that we do in the Guyana well-being study. And as I ride around the country and visit different people, it's always without exception that people run up and say, "Oh, Dr. Adu-Krow, I haven't seen you for a while. How is Paho?" Everybody, almost everybody in Guyana knows him. He is, in fact, the on-the-ground presence of the Guyana well-being study. And if I could ask him to come up for a few minutes and say something.
Thank you, Professor Hoven, Honorable Minister of Health, DVC, Dr. Cummings, colleagues. Thank you for being here. I think this conference has been one that we can celebrate. I always think that Christina is controversial because by the time I got up to say hello, I heard someone saying, "Hello, Grandpa," because Christina just gave me a new name. Thanks so much. We hope that as we grow in what we are doing, we are not only growing in stature in terms of the conference, but also in the outcome, and also in the output and the outcome. Why do I say that? This conference, we have persons coming from St. Vincent, and they had written to us saying that they wanted to be part. Why? Because for almost every year, they had about 4 deaths from suicide. And then 2 years ago, they had 8 deaths. And last year, they had 8 deaths. So for them, it was a 100% increase in deaths as a result of suicide. So they were here. I met somebody from Jamaica. They said, after asking Christina some hard questions, I went and asked him during the break time, "Why were you asking those very hard questions?" He said, "Because I want to start one of my own in Jamaica." So there's going to be, I don't know whether I can call it a sister project also in Jamaica. We had some people also linking up with us from Africa. I don't know where they are, but I haven't seen them as yet, but probably they're somewhere. So it's not only in Guyana, but I think we are making waves everywhere. And as Honorable Minister of Health said, we are hoping that this will become a hub not only for what we do here, but also for the Caribbean. Vice Chancellor said something that I don't want to repeat, but essentially to say that people around the Caribbean will be gravitating to us here. And I'm looking forward to the day and time that will become a reality. Only also to add that there was a study done by one of the professors at the institution, from the institution in Grenada, and he looked at disasters, global warming, and the rise in terms of sea level. and predicted that in 30 years' time, 8 of our international airports in the Caribbean will be wiped out. So today, when the Vice Chancellor said people will be gravitating here because some countries will be no more, I was thinking about that research. So it looks like we are starting something for the whole Caribbean, even before they come and join us, before they come home. So, and then that has become a reality because of all of you. I would also want to, but because before I sit down, Christina, normally they say that when minister speaks, nobody speaks after him. So, Minister, I hope you you forgive me for this. But before I sit down, I would like to say a very big thank you to Prof. Hoven for bringing, I think Minister also said that, for bringing a whole array of persons. I was blown away during one of the sessions that I gave. There were question and answers, and one of the professors asked a question, and a question in terms of the mental health law. And then my colleagues from the Ministry of Health, they were whispering to me, "William, do you know the answer?" I said, "Well, I don't know it myself." And I realized the depth of the knowledge that the persons who have come to help us bring to the table. The question is, did you people add the sunset clause? I said, "What is the sunset clause?" Later on, he told us. But that's just one example. So they bring a wealth of knowledge, to us, and I'm hoping that we digest it, as Minister said, we digest it and make it work for us. So I'll say it again. I think I said it at the opening. Professor Hoven, I don't know where she gets these ideas from. Last year, when she said, "I'm going to let's have a conference," and that was about 2 weeks, to the time. I said, "But where's the money coming from?" He says, "From you and I's, pocket." I said, "There's nothing in my pocket," but it did happen. The same thing has happened this year. We keep asking, "Where's the money coming from?" And you'd be surprised. Sometimes, she takes money from her own pocket. We needed students from the schools. She took money from her own pocket. She asked me, I didn't have anything. So thanks so much, the visiting professors. I'd also want to thank the people that I work with here. Jessica, for doing a lot of errands during these last few days. Alicia, we left you out from the nitty-gritty because you were also involved in the other issues, the interviewing, the questionnaire, the getting persons from the regions to come. So Jessica and Alicia, I don't know where both of you are, but thanks so much for the massive support that we've had from you. Thank you.
So now it's time to identify those 3 things before we conclude. So we heard a lot about the schools. We heard about substance use. We heard about the community. So you have to decide what are the 3 things. What are the 3 things? And every voice counts here. What are the 3 things that we can actually identify and concretize and do over this next year? So I open the floor to any suggestions. We're going to end up with 3 of them. So if we have more, we're going to have to decide. But let's see what we have. So can I hear the first suggestion? We'll have to impose them if we don't get them. Yes.
May I? More inclusion of the hinterland communities where the problem is localized. For example, I would have loved to have people here from Baramita, which is one of the indigenous communities that is plagued by suicide for over the years now. So the Carib-speaking people, I would like to have them included here, more indigenous peoples. I thank you.
Okay. So I just want to be clear that you're talking about more inclusion in this conference, and you're talking about more inclusion where? I mean, I want to be clear. We have to be clear on the target.
You asked a question about what 3 things we can do pertaining to the next conference. So okay. I'm answering it candidly to say that we need to have more inclusion of the communities where the problem is localized. And I've highlighted Barometer over the last 48 hours as a community in dire straits who need help, which needs help. I thank you.
Thank you very much. Okay, we got one on the table.
Hi, Miss. I will suggest private sector. The private sector and the working environment.
Who's, so, yeah, I was looking at him. Yes,
Yeah, the private sector should play a role, also the working environment, and I think we should invite them or allocate them to the next session.
invite who?
The private sector and the working
The
environment.
private sector.
Yeah.
Oh, well, I'm very happy to put that on the list. The private sector was not excluded from this conference. I think everyone heard and saw the announcements from Minister Anthony up to and leading up to the conference, in which he said he encourages everyone to come. No one has ever been excluded. But if you want to talk about reaching out specifically to the private sector, I'll put that on the list. That's a perfectly valid goal. Yes, sir.
This might very well be a hard one in terms of the organization of the conference. And it's related to one of the sessions I attended this afternoon, which looked at an analysis of the morbidity and mortality of analysis of morbidity and mortality data for 2016 for Guyana.
Mhm.
And the breadth of information that was there stimulated in my mind that can we look at that? For me, that presentation should have been a plenary presentation. So in terms of the organization of the conference, can we look at having plenary sessions which can sort of kick off the day, where everyone benefits from that, and then they can move to the different sub areas, if you want to call it that.
That's an excellent suggestion. And last year, for those who were here, if you remember, I did provide a lot more data in the opening session than I did this time. And part of the reason for that is that we have had to postpone the national study. But by this time next year, we have done the first wave of the national study, and it would be an honor to present to the group what we are learning in that first wave of data. There are other data we can also consider presenting, and I think that's a certainly wonderful point to put on there. Yes.
I would say more youth involvement and presentations, because we need to hear from young people.
More youth involvement. So are we talking about more youth involvement in terms of the youth taking on a greater role and having some support to do that? Is that what we're talking about?
Yes.
Wonderful. Perfect. Thank you very much.
Excuse me.
Yes, I think the gentleman there was next.
With any closing sessions, we often ask, what are the next steps? The next steps is a simple action plan. And coming out of this conference, the action plan will be first on the agenda, would be to identify the issues, all the issues, especially how we have capacity building and the data coming out from all those presentations, and be able to relate that to what's happening in Guyana on the ground. We identify those issues. The second thing we need to do is what are the techniques we will be used, the technical skills we will be used. Well, we learned that we can use psychologists, social worker, physiotherapy, and I even suggested as a mediator that we use mediation. The third aspect, who is responsible? They're executing these two that I mentioned. And this is where resource mobilization comes into the picture. See, we need resource people with the necessary skills. I had an opportunity to peruse the act. And the commission that is mentioned in the act is a tall order the commission will have. I heard this morning the task that the unit, the mental health unit will have in executing all these programs around the country is a tall order that unit will have. So this is where the resource people would be necessary to execute it and to bring it to success. We talk about strategic plan. We know about strategic plan. But we also have to put in place a multi-sectorial approach and to coordinate that approach so that we're able to cover the entire 10 regions of the country and make it a success. Let me stop here.
Thank you very much. You made a lot of good points, and I just want to address them briefly. The first one is, what are we going to do about making what happened here at the conference available? And I would prefer that we don't make that a point, but that we assume going forward from last year that that is now a given. So last year, one of the 3 items was to make all of the videos, to have those, have every session edited down and have it available online. We succeeded with that, and we will succeed with this one. All of the talks here were recorded, and they will be online within a matter of a couple of months. They will all be up and available to everybody. So that is a given. That is not, I don't want to put that on the list. The second one you asked about, who's going to be responsible? Well, I think one of the many things that we talked about here at this conference was training in the different areas, whether it's in social work, psychology, psychiatry, bringing all of those areas up to a level that we're all satisfied with. I think Minister Anthony has made it clear that he and Professor Raj Kumar has made it clear that today and the other day in the conference about the new law, and that is how it's going to be implemented and all of the systems they're going to put into place to be sure that people are held accountable. It's not going to be easy. One of the things we talked about in the coercion workshop was, what do you do with the police department that for many, many, many years has had a certain kind of responsibility that under the new law they don't have. They have to change their ways. All of that requires training. And that's what I think the ministry is committed to do, to provide that training. Once the training is in place, then I think it's going to be very clear who's in charge, who's making the decisions. So I think if we want to put in on the list that we have greater accountability and we have a system to identify it, I think that's a perfectly legitimate thing to put on the list. So Avasha, did you have a question or a comment?
No, not a question. I would just simply like to see a bit more country ownership. It's nice that this all started from a small idea or a spur of the moment idea, and just in the second year, we've seen it grown so much. Throughout the presentations, we've seen data from around the world, presenters from around the world showing their interest. And we've seen some interest from the Ministry of Health. So I was just wondering if Guyana could host your next conference. I want to see more involvement from the Ministry of Health. It would be lovely to have more research and presentations from the Ministry of Health, because after all, they are the ones who need to. We've passed a bill. Yeah, there's so many other things that we need to do. There's so many other things at the regional level, meaning activity level things that we need to do. We would love to see the country being what they're doing actually, and where we're headed, because there are targets that we need to meet, whether they're national indicators or the SDGs, and we want to see what the ministry is doing that will take us to that point.
Okay, so just for my own clarity and my own reflection on where we are, is that I think if you look over the program, you'll see a significant number of presentations that were given by people in the ministry, different people who work in the ministry. And if one of your objectives is that we have more people presenting from the ministry, I think that's a perfectly legitimate item to go onto the list. I have no problem with that. If you want to talk about how the ministry might better present itself at next year's conference, I think that's a legitimate question that can go onto the list, an item that can go onto the list that the ministry. I'm not sure what more Minister Anthony could have done. He stood here before the conference on day one, and he laid out many aspects of what has confronted the ministry and resolutions to problems in the ministry. He's just stood here and done it again today. So maybe you could be clearer about what you would like the ministry to do in the conference. I'm happy to respond to it. I'm happy to put it on the list. I just want to be clear what it is.
Can I think this morning there was a session and Dr. Edwards made a comment. A lot of issues were coming out that would have benefited, say, Chief Medical Officer. Chief Medical Officer has not been here the whole week. Other issues that would have benefited other directors of the various units within the ministry. They were not here. And this is the bread and butter of Ministry of Health. Mm-hmm. So I guess, well, I don't know what Dr. Bachan was thinking, but I think when probably she says more ownership, they need to take it up. The minister has said it before that it has to be part of the fiber of the Ministry of Health. There was a presentation on causes of death, and a doctor puts down causes of death as that only God knows. How can that be a cause of death? So these are things that Ministry of Health higher ups, and when I say higher ups, the technocrats have to be here to listen, to hear, and take it up.
So if I understand you correctly, you're suggesting that one of the items on the list be that there be a mandated participation or at least a presence from what you're calling the higher ups in the Ministry of Health. Is that what you're saying? I'm still not clear what you're saying. I apologize. Is that what you just said, William?
Yes, I was saying that there are some things that would benefit us all if, say, Chief Medical Officer, Director of this, Director of that, happen to be here to take them up.
So, do you have positions, or do you have a quantity? I'm not sure exactly what I would do with this. You want to say 5 people, 10 people, 2 people, 5%? What is it? What would satisfy this call?
Okay, it's supporting what Dr. Adu-Krow said, and he's looking at me because I was the person who raised this in the meeting that we had this morning, and I had raised it in other areas. This may not necessarily be for the conference. I like the term that you use, and that is what I was thinking. So it's for the minister, in support of what the gentleman raised about the next steps in terms of taking this information into action and implementation, mandating that senior personnel from the different programs of the Ministry of Health be present at the conference, because they are responsible for implementation on the ground. And that mandate can't come from the conference, but from the minister. That is the idea. I don't know if it's relevant to ask the conference to do that, but as the minister is here, that would be my plea, a mandate that the heads of the various departments of the Ministry of Health be present at this conference, because a lot of issues came up, not only in that, but magnified today. One of it was the death certificate writing. And therefore, when you look at, so for example, cardiovascular diseases was listed as in 2016, the top cause of death in the country. But when you look at the regional distribution, 6 of the 10 regions had external causes, including region 4, as the cause of death. 2017, the top 10 cause, number 1, malignant neoplasm at 10.6%. Minister knows that I did an analysis of cancers in the country. So it meant that Guyana suddenly had an epidemic of cancers and deaths, signifying probably that the care that we provide to persons who are diagnosed with cancer is of poor quality, so that cancers now is the top cause of death in the country. Nobody, we were 4 persons in that room, nobody from the Ministry of Health, Chronic Disease Unit, or whatever was actually there to sort of, hey, there's some things that don't make sense here. What is it that we can do? Recommendations were made from the report. What is it that we can action on? And this was in 2018. We've heard that so far, little or nothing has been done since then. And so are we doing these things just for academic interest, or we want it to be applicable results? And echoing the minister and those who spoke before, if we want to move from being in the top 10 of suicide, lovely presentations were made here. Information is coming forward. But what are we doing with that information to make it actionable so that we can all achieve that goal? So can we have that mandate? Is it the conference do that? That's what we're actually thinking. Yeah.
Okay, so we're talking about it.
I would like to propose, because this is about the mainly youths committing suicide and things like that. I would like to propose that through the student government of the collective schools, via the youth parliament, they have an input as to what will help them, so that it goes for them, by them. So the recommendation comes from the youths, for the youths.
Right, so I think that's absolutely essential. When we put the youth item on the agenda, that's what it is. It's nobody's mandating anything. But to go back to Dr. Edwards, I think what you're asking is that we put on the list that there be some appropriate level of representation by the Ministry of Health, and that for this conference. I don't know what the appropriate level is. I asked that a minute ago. Are we talking about a percentage? Are we talking about a number? What are we talking about? If we could quantify that in some way, then I think we can put it on the list. And we're not doing a cardiology conference, but we are talking about well-being. And if you're talking about contextual factors contributing to ill health, and that it's differentially distributed in the regions, then that's certainly something we should be looking at. Because if you have, a differential in cardiac problems, you probably have a differential in suicide. So I'm perfectly happy to put it on the list, but you need to quantify it for me. And
I think it's a question of leadership. What the
Sorry?
doctor is saying is leadership. Those in the leadership in those departments, they need to be present. If you are the chief medical officer, you need to be here. If you are the director within a public health laboratory, you need to be here, because the issues going forward, it falls under your leadership. So leadership matters. I thank you.
Okay, so I'll go a bit further. Leadership matters. So at a minimum, and I mentioned it, the directors, so for example, under disease control, as far as I knew, there were 9 sub-programs. There may very well be more than 9 sub-programs. Representation, directors.
So there's 9 programs, and you want at least one person from each of those.
Right.
So
Secondly, there are 10 regions in the country. Each is headed by a regional health officer. So there you have 9 and 10, 19 persons. What percentage that represents, I don't know. but I'm giving you there a minimum number. So there's representation from central ministry as well from the regional level. And this also, Nicole spoke about the communities. And here is the person who's responsible for health in Region 1, which barometer is in Region 1. And so the actionable items, they should be present here to get this information, which is also help them and also help us, the citizens of Guyana, to monitor what they do to address these issues in the various areas.
Okay, thank you very much. I think one of the things we have to keep in perspective is that, you know, some of us love this conference maybe more than others, but I think we also have to realize that while we're having the conference, life goes on outside of this conference. Life goes on in every single region. And I think it would be unreasonable and unwise to tell Minister Anthony that he has to bring all of his leadership from all 10 regions to this conference for 3 or 4 or 5 days and pretend that life doesn't exist outside. I think that doesn't make sense. I think if we want to say to the minister that he needs to have a better representation of regional health officers here, of people who are in leadership positions, and we come up with some kind of a percentage, I think he has to do his job, and that is to figure out who he can let go and who needs to be in position. You can't have everybody here. I mean, I love the conference, you love the conference, but life has to go on and we have to be available to provide services. That's what we're talking about. So let him respond.
I think the point has been made that, okay, we should have more participation. And we'll try to figure out how we can get more people to participate. But, you know, it's interesting because Dr. Bachan raised it. Dr. Bachan works in the CMO's office.
No, Minister, sorry.
You don't work in the CMO's office?
No, I am not with your ministry anymore.
Oh, so you're no longer there. Okay. But the point is, well, up to recently she was there. But so that's one thing. One, I know throughout the days here, there were people from the ministry who attended. And if we go back to what was the attendance last year, we had fewer people. So it's increasing, but that's not really the issue. The issue is, and as I said it when I was speaking, what we need to do is to summarize the recommendations that come out from the conference, which is what we will do. So we'll have recommendations. So if there's something, as Dr. Edwards was pointing out, relates to how we have treated the data on mortality, then certainly we have to look at that, because I don't know what was the methodology used, how they collected the data, what was primary source, whether that was adequate, and I don't know. And whether what is being presented was accurate. Mm-hmm. So these are things that obviously we'll have to look at. It would have been nice if somebody from the ministry was there who was up to date on the data, and maybe they could have provided responses. And that would inform the audience in real time that maybe yes, no, whatever. And that's desirable. So obviously we'll have to improve, especially when it comes to the local presentations, so that we can have a more informed discussions, because sometimes there are methodological flaws and so forth, and that we need to work on improving. So I don't see a problem with getting at the appropriate time people participating in this way. But out of the conference, as we did last year, we took the recommendations that came out from the presentations and we worked on them. It would be no different this year. We probably might have more recommendations that are emerging, and we'll try to work on them to see how much of them we can implement. And that's how we move forward. So I don't think we should belabor the point and go over and over and over. We just need to move forward. And I think that's the way we will get things done.
Thank you very much. Yes.
Yes, good afternoon, everyone. I'm just coming back to the suggestion that was made about a private sector involvement. if we are placed in the top tier for suicide deaths, then the persons who would have ended their lives via suicidal means, they work in a workspace. So for me, what can the conference do to mobilize the corporates and the public sector as to the role they have to play in the reduction of the suicide rates? So that's my contribution, and that's the suggestion I have for the next conference.
Thank you. I think what you're speaking to is the purpose of the conference, which is why it's not some unidimensional conference, but it's actually attempts to be multi-sectorial. We want everyone at the table. We want to raise all the voices, and we want to raise the awareness. That's how we're gonna reduce suicide. So I'm not exactly sure what you're suggesting above and beyond what the conference is already attempting to do. If you have a particular goal, please state it.
Sorry, I didn't hear the question.
I said if you had a specific goal that you would like put on the list, and remember what we're working on here is the list of those things that we can attempt to achieve during the next year. We're looking for a list that we're then going to collectively pick 3 of them, and that's what we're going to try to do over the next year. So if you could articulate clearly what it is you want on that list, I would be happy to put it on the list.
Mobilization of the public sector and the corporates to have them here so that they can know how they can contribute to the reduction of suicide, because these persons work in their spaces, and what can they contribute to reduce that?
Mm-hmm. Okay, one of the things I've been asked is if you're done speaking, if you could turn your microphone off, because there's apparently some disruption to the system. Thank you. Okay, so did we get that item, William? Do we know what that item is?
Yes. Do you know what she's done?
Yeah, okay. Josh?
Thanks again. I know during the sessions we mentioned that there were some talks about publishing the abstracts in a supplement next year. Mm-hmm. So I'm hoping that you'll take the year up until the conference time to make sure that happens.
Okay. Do we have any additional items to go on the list? Yes, sir.
Since our children at school is involved in some way in mental health, what we need to do is to put counselors in each school. I mean, it might be very costly to do that. But then, whatever happens at school, it must not escalate beyond the counselor at school. The counselor at school would be so competent to train in every issue there, even if it called for interdisciplinary training in mental health. You're a counselor, but you have interdisciplinary training in mental health so that you can function to help the children at school. So we need to have that.
So if I could rephrase that, what you're asking for is the development of a formal relationship around mental health with the Ministry of Education, so that we can address the problems that you've just identified, which are big problems, and as you say, you can't do them overnight. So, but if we can develop a formal relationship with the Ministry of Education, we can move forward. Is that correct? Yeah. Is there any other item people would like to get on the list? Yes, sir.
Yeah, thank you. So I think we've been talking here about training, we've been talking about research, and we've also talked about greater involvement in providing service base. I think within all of this, there is a greater need for cohesion. One of the things that we sometimes our work is incremental, right? And So that leads to one person doing this, the other doing that. And so I believe that we should come up with some sort of a multi-sectorial policy. We talk about getting agriculture involved, home affairs involved, and so forth, but how do we piece all of these together? You know, for instance, the Columbia University Psychiatric Institute, you know, when you go there, there is all of those levels of training, education, quality assurance. It's under one umbrella. And my suggestion is mental health now becomes an institute. It becomes something that we have to include all sectors, and it has to be somewhat, and my suggestion, particularly for the minister as well, is a multi-sectoral approach, a policy that sort of institutes this and involves everyone. And I think this is the great thing of this conference, because it brings all these three things together. And every year, I think the great thing about this conference, it continues to nurture that. It continues to bring up the themes that we need to improve. And so we'll get better. And lastly, I want to just congratulate you, congratulate the minister, everyone. This is very good. Last year I watched this online. I'm happy to be here this year. And I can only see great things happening. And let's build this institution and let's make it better, because our country needs it. Thank you.
Thank you very much. If I heard you correctly, perhaps what you're talking about is the role of mental health becoming more powerful and independent within the ministry. And that may in fact mean that that mental health should become an entity in and of itself, not part of non-infectious disease, but actually report directly to the minister. Because I think what we're talking about is it is multi-sectorial. It does require everyone being on board, and only the minister can make that happen. And as soon as you create layers, you're making things more difficult. So I think, is that what you're saying, sir?
Yes, ma'am. Thank you.
Thank you very much. Okay, so we're done with our list. Okay, William, you got the list? No, put your microphone on. Maybe you want to come up here with the list. Come on, I got to have somebody to blame. Bring the list up there.
Christina?
Yes, sir. Yes, go ahead.
In the meantime, is it appropriate for the visitors to make a brief comment?
Sure, you want to make them first? We can do that.
Yeah,
I want to do one thing after we do this, but if you want to make brief comments, go ahead.
Okay, one suggestion that I heard from a person at the meeting was that a support and advisory group for people who use the mental health services might be very helpful to them, and it might be helpful also to the development of the plans and policies that we're discussing.
Could I ask why you would suggest that as a brief comment as opposed to putting it on the list?
That's what I mean with the
Okay.
putting it on the list.
Okay, thank you. Okay. Put your microphone on.
Well, I must first say I was delighted and impressed by the conference as it was.
No, actually, Norman, if you can just wait, because after we pick the three things, you are the godfather of psychiatry, and I'm going to ask you to come down here or sit there and to make some kind of a summation of where we are and where we've been and what's wrong with what we've done. So if you could just hold your comment, unless you want to add something to the list, you can make.
I was going to add two more suggestions, but maybe I'll make them later.
Okay, go ahead.
Two topics that I think would be helpful are, one is the usually forgotten groups. We have done today, we've seen children in school, but we often forget children who dropped out of school. we are talking about very often about people who have families. What about those who are very lonely? And the third, such forgotten group is the people who have a mental illness, who have a physical illness, but also a mental illness, and nobody knows what to do with them. And I think that one topic might be these forgotten groups that would be handled next year. What do we do about them, and how do we go about them? And the second topic might be new forms of training, which would be, how do you train journalists? First you have to attract them, and then you have to train them. How do you achieve that people are trained together, doctors and social workers and nurses and other people who work together? How do we make them trained together as well? I think that new forms of training, for example, of parents, of joint training, etc. So those are the two topics I would suggest: new forms of training and forgotten groups.
Okay. Thank you very much. Okay, the list is closed. Do we have one more up there. Wait, I'm sorry. Go ahead.
Thank you. What about improved promotion and use of the suicide prevention numbers? That it's a toll-free number, that it can be used to de-escalate situations and used for referral, just to promote the use of it, and that it can be a tool for everybody.
Okay. I get myself into trouble all the time. So Maddie Gould, a professor of epidemiology and psychiatry at Columbia University, who gave a talk here at the conference virtually. She is one of the, I don't know, maybe 3 people who's responsible for the new telephone hotline in the United States, which now has a number and it has a backup all over the United States. So this is something that we've been working on in the United States for about 20 years. And Professor Gould is one of the people responsible for it. She is also a consultant on our GWB study. And I have spoken with Minister Anthony and with her, and that is something that we are going to move forward with, working with the ministry to try to bring about a hotline, a national hotline, which will do many of the things that the current hotline doesn't do, including being available 7 days a week, 24 hours a day, having adequate support. So when people call, there's actually somebody that can be referred to. That's a big job, but if we want to put on the list that we will actually start those conversations this year, then I would certainly be happy to put that on the list, because it's already on my list. So I would be happy to put it on the group's list, because I think it's one of the things that we need to move forward with. So can we get that on the list, William? Are you awake, William? Did we get that on the list? The hotline. We want to start the work with the ministry around the hotline. Okay, now we have one hell of a list here. How many items on here? 15 items. We got to get it down to 3. Harder job than we had before. So if you could read, because I can't read your writing, if you could read each item, then if we could have a quick show of hands, then we could start knocking some of them off, because they're not going to get a major vote. So we have to have 3 that are going to get majority votes. So let's start the first one. And if you're interested in it, raise your hand. If you're not, don't raise your hand. And then we can knock some of them off. So can you start?
So probably, Christina, let me read all first so that people have an idea. Otherwise, we vote for 3 and then, I want to read.
No, this isn't a final vote. This is simply a vote of interest. It's a vote of interest, whether they stay on the list for the final selection. Right. So we can try to get it down to like 5 or 6, and then we'll select the 3. Okay. So
the first one is more inclusion of the Carib communities, because they are the ones at the states.
Show of hands. Okay. Interest.
The second one is
you raise your pen. You got to put that.
Involvement of the private sector.
Just put a pause. Involvement of the private sector. I think actually, yeah, I think that absolutely we want involvement of the private sector. And I would suggest that we not leave it on the list, but we just make sure that we do a little better outreach the next time rather than make it an item. They were invited this time, and maybe we didn't do a good job of making that clear. So I don't think it needs to be an item on the list. We just need to do a better job of what we did this time. Is that acceptable? No.
I also
Okay, then you have to leave it on the list anyway. Okay, how many people are interested in that? Could you raise your hand?
Yeah, we are voting.
No, this is a level of interest. Okay, it doesn't have a lot of interest, it goes off the list.
Well, I think we need the private sector, but they need to give us.
I'm sorry, but we're not hearing you clearly.
I'm sorry. So we didn't have a lot of interest. So again, I would suggest that we not leave it on the list. We just do a better job next year. No one was excluded this year, and next year, no one will be excluded, but we are committed to doing a better outreach to the private sector next year. And I think that's what you're asking for. So we can take it off the list because it doesn't have a lot of support, but it's important, and we will do it, okay?
And those of you who have links with the private sector, please tell them to give us money to support next year's conference. Thank you. The third one is, I think, came from Dr. Edwards, that we should have plenary sessions that embraces the topics, that embraces topics that most people are interested in. Any hands?
Any hands?
That we have plenary sessions where everybody is there before breakout.
Okay. Okay.
But that is procedure.
Yeah.
Okay.
We're going to do it.
Fourth one is more youth involvement. Someone mentioned the use of the youth parliament involvement.
Come on, get all those hands up there. Youth involvement, okay.
The next one is someone came up that we should have an action plan that talks about what is to be done, when it is to be done, where is it to be done, and who is responsible. The minister also talked about it.
Go ahead.
The next one is documents to be online as soon as possible.
It's going to be online. So again,
Exactly.
I don't think it needs to be on the list because it's going to happen.
It's definitely going to happen. The next one is greater involvement by the Ministry of Health.
I think it's greater presence at the conference.
Yeah, greater presence.
Always.
Involvement with Ministry of Education, Agriculture, and Home Affairs, and others.
Gee, it has to say almost.
I think there was talk about mental health being by itself and not the subsidiary of a bigger section or unit.
I think some of these things, you got to understand the context in which you're working. For example, this intersectorial getting ministries and so to be involved, there are already things that are happening. So when we are dealing with pesticides, there's a pesticide board that has been established where you have different ministries being represented there. You have a firearm board that deals with controlling the use of firearms and how you issue it and so forth. You have in the Suicide Prevention Act, you have a multi-sectorial commission that is going to be established. A lot of those stakeholders have already been identified in the law, where they're going to come from. So many of the things that we're talking about are already in the law. So one of the things that I would suggest that we do is that we circulate that so that people can become more familiar with what is in the law, because many of these things are already there. what we need to do, because like the suicide prevention one was passed about 3 weeks ago. So what we need to do is get people more aware, put those mechanisms in place, and allow people to participate in these levels, because it's there. That's what we want people to do. Setting up a plan to prevent suicide, that is one of the functions of the commission. They'll have a secretariat. They will have people to work with them. Going out into the regions, that would be part of their mandate. Having people trained in those regions. So all of that is elaborated in the law. So what we need to do is implement what is given, right?
So I have two questions. One, is the law currently, the new law, is it currently on the Ministry of Health website? And are you saying it's going to be there?
We can, it's on the Parliament's website. So you can go to the parliamentary website, the Parliament of Ghana website, and get a copy of it.
Why not the Ministry of Health?
Our website is not working as well, so that's why.
Okay, so I think he said it's going to get sent around, but what he actually meant is it's on the Parliament website, and everybody can go on that website and read the law. And what he has also suggested is that everybody reads it, not just, you know, glance through it, but read it and understand what it can do and not do, and how it's to everyone's advantage. The second part was having to do with, are you suggesting that there is a plan in place to make mental health a separate unit within the Ministry of Health? Because that was part of what people were advocating for.
I don't think at this point we'll be able to do that. And I'm saying that because you have to think about where we're coming from. 1 year ago, we did not even have a department of chronic non-communicable diseases. We have established a department, and within that department, we have put mental health as one of the main disease that they would have to work on. So they're now trying to build this out. Plus, we're now going to set up an independent commission for suicide prevention. This is going to be a separate entity with its own secretariat, its own financing, with a mandate to create plans to go out to do work. So that's going to be a separate entity, and that would report to the Minister of Health. But I think to go add other units and so forth might be a little bit more cumbersome at this point. Let's put what is envisaged right now in the law. Let's put that, set that up, establish it, put it to work. Maybe in a year's time, we can review whether that's the best mechanism, and then we can tweak it. But at this point, we have not even given it an opportunity to work because it's just recent. We just passed the law recently.
Mm-hmm. But if people want to put on the list that they would like to pursue this idea of a separate mental health unit,
they also have to be pragmatic.
Pragmatic, right. Well, yes.
Since so what I'm talking about is not a physical infrastructure. So even if we didn't have a place or whatever the minister is saying, I'm talking about synergies. I'm talking about bridging the education, the training, the research into one under one umbrella. All right. And I don't mind us keeping it in the Ministry of Health. But like I said, one of the challenges we've been having year in year is institutionalizing and ensuring that everything is flowing under one continuum. And that's what I think that this is a great opportunity for us to do.
Okay, it's on the list.
All right.
We're going to vote on it. You know, it's not going to happen today, and there may be reasons for it not to happen tomorrow. But if you want it on the list, it makes sense. We're going to put it on the list for today. We already heard about the suicide, so let's leave it on the list and we'll vote on it. Go ahead.
The next one is support for patients of mental health services. I think this has come up in various meetings. But I don't know what they mean by support. So I don't know whether it's support groups or creating support services for persons who access.
But that I think is an ideal thing, that persons who are interested from the conference, there's nothing stopping you from forming a body that can advocate for patients' rights or to help to work with patients and so forth. But I think sometimes what people do, you come, make suggestions, and then that's for somebody else to implement. It can't work like that. The ministry, we have some technical people, they'll do some of the technical things. But if this is going to work, and if we're going to have a whole society approach, there's scope for everybody to work from different perspectives. And I like this idea that you have maybe like a patient group, patient organization, whatever it is, but we need champions from this body here to take it, and you run with it. You set it up. You go, you help us to do that. So next year when you come, you can report that this body exists and this is what we've been doing. But we should have people do it.
So I think that's a perfectly appropriate interpretation. What we had for Professor Sartorius was talking about carers, talking about the disabled, the forgotten groups, the lonely. I think what we, in this last one here about the support of patients in general, what we should do is cluster all of those together and say that we will move forward in finding ways to support individual groups, whatever they may be, whether it's for the carers or whether it's for the patients or for the chronically mentally ill, whatever it is. So we would make a commitment that we would in fact do work in that area around special populations. Okay, so we can cluster in that case 4 of these. Is that right? Yeah.
Correct. So now the last 2 left are new forms of training, training persons together so that they can bond, so that one group will not look down on the other. And the last one is a hotline.
Okay, so for the issue about new forms of training, I think what we're talking about is training, that we're talking about increasing training at all levels. Is that correct? That we're trying to respond to a deficit in training. We need training in psychology and psychiatry and social work and in nursing. We need training everywhere, right? So I think this point here is that we're simply making a commitment that we will spend energy on increasing training.
Even with training. So in the postgrad program, we have a psychiatry program. So doctors who are interested in doing psychiatry, there's an existing postgraduate psychiatric program that is available for training. We just two weeks ago, we had a graduation. 1 psychiatrist graduated from the program. But we need more people to go in. So if 1 or 2 are going to go to the program, that's not going to be enough.
No.
So if doctors who want to do psychiatry, we have right now 14 specialization programs that we run out of the postgrad institute, right? One of it is psychiatry. So it's not going to create a new program. We have an existing program. What we need is people to come to the program. So that's one. In terms of clinical psychology, UG got a psychology program. We need people to go, if they have an interest, go join the program. In terms of training nurses, the ministry on its training division, we have a program to train psychiatric nurses. Now, maybe that one we need, because it's probably a bit dated or whatever, we can relook at the curriculum and offer the course again, but we have to get people with interest. We have 70-something people at the Fort Kanji Hospital, the National Psychiatric Hospital, that did psychiatric aid. They were trained. I have asked the leadership over there to now upgrade them. So with UNICEF support, we are going to upgrade this something people and do some specialized modules that they are now developing and bring them up to the level of nursing assistants. So the programs in many instances exist. What we need is people to come into the programs to be trained, right? And then one of the other things that we will, and the IRDF people, they're going to be doing all these resilience, cognitive behavioral therapy training. So over the next year or so, as part of the mandate of that project, they have to train at least 4,000 or 5,000 people. And again, this is open to the general public. So the courses are going to be there. What we need is people who have an interest in these things to be identified, and they come and they get the relevant training and go back and apply it and use it. So the point I'm making is that there are opportunities. Now, whether that is going to fulfill the needs that we have, that's probably we need to examine that. Plus, the other type of training that we need to do, the MH gap training. We're using that module to train primary care physicians. And that is going to continue for us to train everybody who is rotating in primary health care, at least to go through that program. So there are lots of training opportunities. I don't think what we need is more people to get involved. I think that's one of the areas.
Right. So I think,
And if I can
to
just
one
add,
extent, we're answering this call this next week. We have training here in child psychiatry. We have training in suicidology. We have training for the psychologists, for the social workers, and we have an expert coming in on MH gap for children. So this next week, there will be a lot of training going on, but I think the point is that we need a lot more. And I think Minister Anthony has identified a lot more that's being put into place. You know, there's a limit. There is a limit. Always you have to be reasonable.
Yeah, I just want to add mental health nursing as well. We also have that.
Yes.
And also family medicine, which the primary care minister mentioned. So there are many programs we already have.
But I think to come back to Professor Norman's question, it's not the training. He says we should train various categories together. So exactly. So probably the MH gap, we bring the doctors, nurses, everybody together so that they see themselves as comrades and not, oh, well, I'm the doctor and you are there. So the MH gap, the IDRF, training, we should have all the categories together for each category. And that is the innovation he's talking about.
No, when there's value in doing these cross-training kind of thing. But I think initially what we are looking at is improving basic mental health services. We can do that by more people getting involved in these courses and getting training. So that's one step. And then we do the cross-fertilization, if you like, with different programs.
Okay, so there's one more, and that was
hotline.
The work.
There is also a hotline. What happened is that sometimes they don't work as efficiently, but that we can improve. So
right, but I think that was the point, that we just had a 20-year experience of developing one that does work, and that we want to bring that person here. You and I have talked about that before, to see how we can make the hotline that's here work better, be more efficient, and actually have the kind of backup and coverage that is needed. So that's that item on the.
Maybe one of the things that we can also think about, because they have all these technical things.
The list is closed.
Make an app.
Make an app.
Make an app that people can have on their phone,
right,
or they can download or something,
right,
so they can reach out for help. They can text for help or whatever.
Okay, good.
So that's something that is not.
Okay, so now we have 1, 2, 3, 4, 5, 6, 7, 8, 9.
9 items to vote on. We're going to have 3, right? We're going to do this just simple majority vote. Okay, so you want to start at the bottom and go back up?
Okay, have an app. All right.
There was actually a presentation during a conference about an app that is already being developed. So I think we can, maybe it needs to have more of a mental health component, but that's fine. I would argue that a lot of the topics that have been discussed are a little outside of the scope of the conference. And so I don't know, maybe we should.
Right, they are outside the scope, but we have the vote on an app. We're trying to just determine. Where was that?
Okay, so how many people are voting for the app? 1, 2, 3, 4, 5.
Right. Thanks. Okay, put
5. No, Minister and Prof. 7.
Okay, go ahead. Next one.
Hotline. Making the hotline better. 1, 2, 3, 4, 5. That's why I said making it better. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Support groups, and for support groups for mental health patients, for forgotten groups, and for persons who live alone. Support group. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
Did you get all those people?
Yeah.
No, you didn't. Could you raise
15.
your hand again? Do it again.
Again, your hand out. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 22. Oh, well, okay.
Okay. Next.
Involvement with the various sector ministries, education, agriculture, home affairs, others.
What is it?
Involvement, that's we should involve these education, agriculture, home affairs. How many? 1, 2, 3, 4, 5, 6, 7,
8, 9, 10.
10. Greater presence greater presence of pertinent Ministry of Health officials.
At this conference.
At this conference, sorry. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. To have an action plan, what is to be done, when is to be done, where to be done, and who is responsible.
So this is one of the things that that there's a limit to what we can do. I mean, we can fetch and encourage, but we cannot, as a group for this conference, we cannot create an action plan. That's the Minister of Health has to do that.
The Minister requested that we produce an action plan out of this conference. That we can do in terms of implementation. That's another issue.
Okay.
So how many?
I just want to say they're dimming the lights as a warning. I'm supposed to come out of here, so hurry up.
Okay. So how many for the action plan? 1, 2, 3, 4, 5, 6,
7, 8, 9.
8. Okay, 9. More youth involvement. More youth involvement. 1, 2, 3, 4, 5, 6.
Well, that's not fair. The kids all left. They all wanted the.
No, now we are voting to come up with the 3.
The 3 top.
Well,
top
Minister is saying that we should do all.
Sure. Yeah.
So we are in agreement?
No. I mean,
Okay.
I would love to do all, but I can't.
Okay. How many want more youth involvement?
Okay. But the kids all
that's-
left. 1, 2,
3, 6, 7,
4, 5, 6,
8,
7,
9, 10,
8,
11.
9, 10, 12, 16, 17.
That they born. How many?
20.
20. Plenary sessions for very important topic. Yeah, okay, 2 there. So 22. Plenary sessions for umbrella issues. 1, 2, 3, 4, 5, 6, 6. The last one, more inclusion of Carib and peasant communities. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28. Well, I got 28.
Okay.
All right. So
what's the top numbers?
So that
this one?
Yeah, more inclusion of the Carib communities.
Mm-hmm. Yeah.
The next one is 24 support groups.
The special groups?
Yeah. Then the next one is more youth involvement.
Oh, youth involvement. That's it. Those are 3.
Youth parliament included.
Okay. So we got 3. You want to read these 3?
The 3 are more inclusion of Carib communities, more youth involvement, the youth parliament and all that, and then support groups for forgotten groups, persons who live alone, and persons who utilize mental health.
Okay, thank you very much. We have marching orders now. We have 3 things. Thank you very much. I've gotten word that they're going to lock us in here downstairs if we don't come out pretty soon. So before we end, I would like to ask the grandfather or grandmother or however he describes himself, Professor Norman Sartorius, if he, who's probably been in more conferences around mental health than all of us put together, if he would like to just say a few words about what transpired here and what he sees for us going forward. So you can do it there if you want.
Thank you very much for asking me to do this. I must say that I was amazed and very impressed by this conference. I've seen very many conferences, but this one has features which other conferences did not have. Number one, I think it was cordial, and it seemed that everybody knows everybody, and people were listening to each other with interest, and they were together. I think perhaps the food and the coffee and everything else contributed to this, but it was very nice. I mean, people were not going out to have coffee; they stayed here, and it really was as if a family met, much more so than other conferences I know. Opposite from what somebody says, I also felt that the presence of the minister, His Excellency the Minister, as well as other people from the government, has been much more than I have normally seen in conferences. Normally a conference takes place and then somebody goes around and says, months later reports to the ministry what happened. This was not the case here. And I think to have you here with us for such a long time is unheard of. I hope you will continue the same way, however. I thought the topics were generally very interesting, and somehow what was missing was the presence of the press, of the radio, or of the newspapers, or people who would spread some of the news that we had, maybe a press conference about one topic or about another topic. Somehow the involvement, it is people who were here have been very much involved, but it would be nice that what has been found and what has been said gets a wider audience as well. So that is something that was maybe missing. But above all, this conference has something that is, I think, quite unique, and I speak here worldwide. It's not a conference like the others, where people exchange views. It is somehow a step in building a program, which is very different. It is the application, and people speak about their experience and what they're going to do tomorrow. And I had a feeling that it is a moment of where people who work on a common cause get together to talk to one another a little bit and learn what each other are doing. It's very different from the conferences which you normally see, where a series of people present their work about science, this, that, and the other. Here, it's been different. People spoke about something, and in a way, it was as if they were inviting others to come and talk together with them. And I think that combination between practical application of an idea and a conference was quite unique. I must say that the technical organization was outstanding. I wish I knew who was doing it, because we might steal him for the World Psychiatric Association and for a number of other conferences. But it's certainly something that one also has to. It's in fact not only that it's an excellent organization, but also it happens in a low-income country. And that, of course, is an additional extraordinary feature. You are normally expecting that conferences will be, everything will be wrong. But I think thanks to various people who are here, somewhere here?
That's her right there, Nikita.
Whoever has done it deserves all praise that you can possibly imagine. There was only one shortcut, one interruption of electricity that I noticed, but apart from that, it was really perfect. So if you want me to say what I would say to people when I go home about this, I say this was an unusual conference in many ways, in its concentration or its focus on practical applications, on the involvement of very different people of different professions, of different types of work which they are doing, of different experience. It is really being a get-together more than a scientific conference. It's a get-together in the course of a program, which I think has an excellent chance to succeed, thanks both to the commitment of the government, but also to the notion that people who are here seem to want to do what they are doing. And that is undoubtedly the guarantee of progress. I mentioned some of the things earlier as suggestions to be added, and I think your voting for what should be done next year is a very nice idea. But it is really, it's the spirit of this conference which is unusual. The topics almost do not matter. It is, you're together, you talk to each other, you get inspirations from others which you didn't know you had, and all right, you listen to a lecture, but it's in fact what you've heard from somebody which makes you different. So please keep it as it is and continue with it. And I hope that other people will want to imitate what you're doing. Thank you.
It's Friday, Minister. Do you have any champagne? Please. Thank you.
Forward to our third annual conference. We have our marching orders, and I want to thank everyone sincerely for all the great participation. I particularly want to thank the people who made it all possible, and that's a number of people sitting over here, Megan Ryan, Iju Shu, all the technical people that did the work, for Justine Wright, who made all of the beautiful web pages and so forth. And I want to thank all of our illustrious guests who came from Switzerland, Israel, Australia,
yeah.
Hungary. I mean, it's a wonderful collection of great leaders in the field of psychiatry and suicidology. They came here to help. They're all coming back. They're all coming back. And I want to thank everyone for a great, great conference. Goodbye. Go downstairs, find something to eat.
There is a cocktail downstairs, so please partake in the champagne that Minister
We need it.
cocktail.